We believe that Amprion's secret sauce is our ability to uniquely detect at very high accuracy and very high sensitivity the bad players in this misfolded cascade of A beta, tau, and synuclein. So just to recap, A beta and tau appear to both be misfolded in patients with Alzheimer's disease, and it appears to be the cause of the progression of the disease. But A beta and tau both appear in multiple forms. There's the normal form of each, which functions normally in the brain, and then there are at least two misfolded forms of each. One which leads, in the case of A beta, to form very large insoluble aggregates, which under the microscope are called plaque. And then also there are invisible forms that are smaller soluble aggregates that appear to spread from cell to cell, and this is what we believe, and many in the clinical and scientific communities now believe, this is the manifestation of the disease itself. This is the molecular basis for the disease. Same with tau, where the very large misfolded form is in the form of what we call neurofibrillary tangles. We have a normal form, but we have this intermediate form of small soluble aggregates. These small soluble aggregates are present in vanishingly small amounts in the brain because almost no technology allows one to be able to see these, even though we know that they must be there because the disease is spreading. Amprion's key contribution, and the contribution of Dr. Soto and others who have worked in parallel with him, are that we can now take the small amount of soluble, aggregated, misfolded protein for A beta, synuclein, and tau, which is impossible to see otherwise, and we amplify it. We take one copy and amplify that to be billions or trillions of copies or more, so that you can now look at this, you can detect it, you can do structural analysis, you can develop drugs against this. And so Amprion's secret sauce is that we look at the part of the disease that is most troubling, the part that causes the progression, the spread from cell to cell, the recruitment of a handful of these to large numbers over time, that is the actual agent of damage, irreversible damage in the brain. Amprion detects it early. Amprion can detect the extent to which it's progressing. Amprion can determine if a drug is slowing down the progression and the spread of these particles through the brain.